When I asked ChatGPT to summarize the challenges and opportunities Indian dentistry poses today, it gave me this. Challenges: 50% of Indians with dental issues rely on unqualified or informal sources. Dental care is often seen as a luxury, not a necessity. And there's a present bias, preference for short term relief over long term health benefits. It also gave me some opportunities. There's a growing shift from disease focus to prevention. The rise of branded dental chains is making dentistry more accessible, professional, and scalable. There's growing interest in digital dentistry for scanning, planning, and printing. And there is rise in cosmetic treatments due to rising income and awareness. Hello, everyone. My name is Dr. Kiran Malviya, and I'm currently serving as the Senior Vice President for Enterprise Solutions Business at the Straumann Group for the EMEA region. I live in Amsterdam, and I've been here for the last 10 years. And I intend to share my perspective on Indian dentistry from a global lens today. First of all, I would like to be excused for not being able to join in person because of certain personal reasons. I couldn't really make it today, but also allowing me to be still here virtually and share my thoughts. I would like to also thank the Dental Growth Summit team, especially Vishy, who invited me to share my insights here. And I'm so happy about this initiative because when I looked at the agenda, I felt that for the first time in India, such a large group of dignitaries from across healthcare are gathered to discuss the future of dentistry in India. And I'm super glad to have a part to play in. Now, before I go into sharing my observations and insights about dentistry, I wanted to say that it's truly special for me that the event is in Hyderabad because this city was a witness to a very important chapter of my life. Well, after spending a decade as a dental practice owner and a clinical dentist in India, I had decided to take a rather unconventional step and pursue MBA at the Indian School of Business right here in Hyderabad. It was not an easy decision because I had to leave my 7-year-old daughter and a flourishing practice behind, but that decision changed everything for me. I moved into the medtech world by joining Philips post ISB, and where I could manage businesses that had nothing to do with dentistry. So I looked after MRI, CT scanners, cath labs, ultrasounds. I even learned about digital pathology systems, and it gave me an exposure to another side of the healthcare world. For over a decade, I was far removed from dentistry, but those years gave me something invaluable: a broader perspective on healthcare, and a deep passion for driving change through technology. I realized that technology alone is not enough. The real challenge and the real opportunity lies in creating business models that unlock the three fundamental barriers in healthcare: awareness, affordability, and access. And these are not just buzzwords. These are the difference between care reaching millions or staying out of reach. All right. Now let's connect this back to dentistry. So you now know that I'm a dentist by education, practiced for around 10 years, then moved to the healthcare medtech world after pursuing an MBA. 10 years or so in the medtech world and coming back to dentistry through Straumann Group. So it's been a full circle for me. And I would like to really, match these two experiences into giving my perspective today. I feel that India is at a fascinating juncture. We have one of the largest pools of dental professionals in the world, yet the way we practice, the way patients perceive care, and the way businesses operate is still evolving. What I have tried to do here is used 4 strategic pillars of transformation within dentistry to capture my observation. The first pillar is community. When I say community, I mean more than the patient community or the population community, but over to the dentist community. Now, India has over 300 dental colleges, producing the largest number of dentists globally, yet professional collaboration is fragmented. Whether we like it or not, we are still a very individualistic community in our approach to dentistry. What I mean is, in my experience in the US and Europe, dentistry thrives on trust and networks. Communities of practitioners work together to not only share best clinical practices, but also share resources and business learnings. Now, this might also be due to the high degree of consolidation, like in US, UK, and Nordics. More than 30% of doctors are affiliated to a network. And networks, they come in different formats. You have centralized ones like Club Dental in India, which are focusing on standardization of care. You also have the highly decentralized ones like the buying groups, which only focus on source optimization. But this at least gives a platform where the doctors can interact with each other and help each other because they are all working towards a common goal. So, building stronger communities has an impact on uplifting the combined value of the profession. It gives a stronger voice and a more relevant seat at the table. The opportunity here for us is to build scalable models that integrate oral health into broader public health. Second pillar is education or professional upskilling. Now, while global dental schools are integrating AI, CAD/CAM, teledentistry into the curricula, I see that many Indian programs still lack in digital readiness. I may be wrong here because certain universities are probably already doing that, but the ones that I have been exposed to still do not. Now, not only that, many well practicing dentists today are also not investing time and money in upskilling themselves. Continuous learning is no longer optional. Clinical skills, yes, but digital literacy, business acumen, patient communication, these are all basics that a doctor must know. I see many countries forging partnerships with large corporate players and suppliers to enable uplifting the quality of technological dental education. India also has a lot of best practices. For example, I'm aware of my dentist in UK, which is working with certain universities in India to support a steady flow of talented and well-skilled dentists towards UK. So the opportunity really for us lies in letting corporates and suppliers become knowledge partners. The third pillar is technology. Now, in North America alone, 85% of clinics use AI diagnostics and digital radiography. Imagine in India, what is that rate? It's only 20% or lower. Use of intraoral scanners for impressions, using smile design, treatment planning for implants, design softwares for final tooth designing. These are now almost 70% plus penetrated in the Western world. Also, AI-powered diagnosis, 3D printing, customized prosthetics, data-driven practice management. These are all focusing on efficiency, personalization, and remote access. This is no longer a future vision. It's here. It's right here. The question really is, how fast will we adopt? That is the opportunity for us. And fourth is business model evolution. It focuses on scalability, quality control, and financial stability. What does this mean? As I alluded to earlier, in US, DSOs account for 30% of practices. This enables scale and efficiency. In India, because most of the practices operate like SMEs, they have limited access to capital and technology. Now, India today only has a handful of business models, which still makes the market highly fragmented. Imagine the amount of value that is still waiting to be unlocked if only dentists start to work together rather than compete with each other on price wars. So the answer really should be franchisee, hub and spoke models for tier 2 and tier 2, 3 cities, subscription-based care plans for affordability, retention, M&A, strategic alliances to consolidate fragmented markets. The opportunity really lies in the shape the future of dentistry through platform-based ecosystems. Quality, price, quality of life for a dentist, all can be improved with a bit of working together. This only requires a mindset shift. All right. Now coming to an elephant, which you all might be thinking of in your mind, and I see standing right in the middle of our fraternity. What is that elephant? In countries like US and Switzerland, dentists earn 150,000 to 230,000 average annually. In India, if you compare that, it's hardly 3 to 12 lakh INR per year. Why? Why are dentists among the highest earners globally, but not in India? I think there are three factors to it. Cost of care, of course, a dental implant, for example, costs 3,000 to 6,000 in US, while in India, it's one-tenth of that price. Insurance and financing, you have at least 50% of Americans having dental insurance. Most of India remains largely out of pocket. And technology and efficiency, as I said earlier, AI-driven workflows and DSOs in developed markets, they help improve margins and patient experience and help make dentists becoming the highest earners as well. So availability of resources versus availability of talent is the biggest difference. What do I mean by this? In India, getting admission into dentistry is mostly an afterthought. When one does not get into MBBS, they get into dental. And now, disclaimer, I'm one of them. I know it's not true for everyone, but this is generally 80% of the cases. Most for the students, it's not really the first choice. While in the US and Europe, pursuing dentistry is a choice for students. So the opportunity, and if I try to convert this into an opportunity, because I don't want to sound as if I'm saying this is a problem, because honestly, I look at this as an opportunity. How? The opportunity is that we have a large talent pool of people already educated in dentistry who can then be redeployed into a professional career of their choice in the business of dentistry. The problem of understanding the dentistry or understanding the industry is not there. Now, I want to summarize all my key insights using the 4P strategic framework, which I have to say I heard from Mark Alna, who's the CEO of Bupa Dental Care in UK. He's an outsider who came into dentistry to turn around the Bupa Dental Care business around 3 to 4 years back. And he used a 4P strategy to shape the framework of his change. And I do believe that this is a very easy framework that we can also use and easily translate it in our context. First P, practice. Practice, which is a dental practice. Now, globally, digital workflows, 3D printing are standard. In India, we need new business models to drive this adoption, which can suit our economic reality. Patience. India has a mix of affluence and poverty. Our business models need to cater to both these customers. But dentistry, it can be uplifted by working on awareness and access together. Third is practitioner, a dental practitioner. In the West, work-life balance and specialization drives career choices. While in India, we see a lot of dentists still juggling clinical work with entrepreneurship. New options will unlock new possibilities. The duty lies on the shoulders of the healthcare fraternity. And fourth is planet. Sustainability is now a core agenda globally. Europe mandates eco-friendly dental waste management. So the question is the Indian Dentistry Associations ready to take the challenge? In India, a practice is like an SME, entrepreneurial, resourceful, but often isolated. To thrive, we need to think like global businesses, embrace digital dentistry, build collaborative networks like DSOs, invest in continuous education aligned with global standards, and focus on patient care, patient experience, and sustainability. My journey so far has taught me that India has the talent, the scale, the ambition to lead in dentistry. I believe in the India opportunity. The question is, are we ready to integrate the four pillars, community, education, technology, and business models into a future-proof ecosystem? If we do, the next decade could belong to us. I wish all of you a very fruitful and productive day here at the Dental Forum. And I hope to be there with you in person next time. Thank you so much again for this opportunity and have a good day. Bye-bye.